Hi everyone, welcome back to my YouTube channel. Today's video is about CMS proposed rule for fiscal year 2025 Inpatient Rehabilitation Facility Prospective Payment System. Let's get started. On March 27, 2024, the Centers for Medicare and Medicaid Services or CMS issued a proposed rule to update Medicare payment policies and rates under the Inpatient Rehabilitation Facility Prospective Payment System and the IRF Quality Reporting Program or QRP for fiscal year 2025. CMS is publishing this proposed rule in accordance with the legal requirements to update Medicare payment policies for IRFs on an annual basis. Proposed updates to the fiscal year 2025 IRF PPS payment policies. For fiscal year 2025, CMS proposes to update the IRF PPS payment rates by 2.8% based on the proposed IRF market basket percentage increase of 3.2% less a proposed 0.4 percentage point productivity adjustment. CMS is proposing that if more recent data become available, for example, a more recent estimate of the market basket update or productivity adjustment, CMS would use these data if appropriate to determine the fiscal year 2025 market basket percentage increase and the productivity adjustment in the final rule. Additionally, CMS proposes to update the outlier threshold to maintain outlier payments at 3% of total payments. CMS estimates the proposed technical rate setting changes would result in a preliminary estimated increase in IRF payments of $255 million for fiscal year 2025. This reflects a $280 million increase from the update to the payment rates and a $25 million decrease due to the proposed update to the outlier threshold. Proposed wage index update for revised census data. CMS also proposes to update the IRF PPS wage index using the most recent Office of Management and Budget statistical area delineations based on the 2020 decennial census, which revises the existing core-based statistical areas. Any wage index decreases will be mitigated by the permanent 5% cap on negative wage index changes, regardless of the underlying reason for the decrease. In addition, CMS is proposing to phase out the rural adjustment for IRFs that transition from rural to urban status under the new CBSAs or core-based statistical areas. These IRFs would receive two-thirds of the rural adjustment in fiscal year 2025, one-third of the rural adjustment in fiscal year 2026, and no rural adjustment in fiscal year 2027. This approach is consistent with how CMS implemented this policy in fiscal year 2016. For fiscal year 2025, CMS estimates that 8 IRFs will change their status from rural to urban. Proposed updates to the IRF Quality Reporting Program. Beginning with the fiscal year 2028 IRF Quality Reporting Program, beginning with patients admitted on October 1, 2026, CMS is proposing the adoption of 4 new items in the IRF PI as standardized patient assessment data elements under the following social determinants of health or SDOH categories: living situation, food, and utilities beginning October 1, 2026. These items support a culture of engaging with and advancing equity in IRFs. Among other reasons, identifying patient health-related social needs or HRSNs via collecting these items may assist IRFs in better addressing those identified needs with the patient, their caregivers, and community partners during the discharge planning process if indicated. Beginning with the fiscal year 2028 IRF Quality Reporting Program, beginning with residents admitted on October 1, 2026, CMS is proposing a modification of the transportation item under the SDOH category. As part of their routine item and measure monitoring work, CMS has identified an opportunity to improve the data collection for this item. Specifically, the proposed transportation item modification will improve and align data collection in three ways. First, the guidance will clarify the look back period for when a patient experienced a lack of reliable transportation. Two, the response options will be simplified for the patient. And number three, the revised assessment item will be collected at admission only, which will decrease provider burden since the current assessment item is collected at both admission and discharge. Beginning with the fiscal year 2028 IRF Quality Reporting Program, beginning with residents admitted on October 1, 2026, CMS proposes removing the admission class assessment item collected at admission from the IRF PI item set. CMS routinely reviews the IRF PI for redundancies and opportunities to simplify data submission requirements. CMS has identified that this item is currently not used in calculating quality measures already adopted in the IRF Quality Reporting Program or for purposes unrelated to the IRF Quality Reporting Program such as payment, survey, or care planning. Request for information or RFIs. CMS is also requesting public input on the following RFIs, which will help develop potential policies for rulemaking in future years. Future measure concepts for the IRF Quality Reporting Program. This request for information aims to receive feedback on potential measurement concepts that could be developed into IRF Quality Reporting Program measures. CMS continues to evaluate, refine, and develop new quality reporting program measures to ensure that people with Medicare and their caregivers have meaningful information for making informed healthcare decisions. Specifically, CMS seeks feedback on the measure concepts of vaccination composite, pain management, and depression. Creating an IRF quality reporting program star rating system. Currently, the IRF QRP does not have a star rating system to supplement existing publicly reported quality information for people to use when comparing IRF quality of care. The agency is seeking feedback on developing a five-star methodology for IRFs that can meaningfully distinguish quality of care offered by providers and would also be reported on both Care Compare and the provider data catalog. Star ratings for IRFs would be designed to help consumers quickly identify differences in quality when selecting a provider while also helping to promote competition in healthcare markets. This RFI seeks input on criteria that could be used to select measures for a star rating and how a star rating should be presented to consumers. This is it for today. Appreciate you joining me. If you found this information useful, please consider subscribing to my channel. Thank you for watching. Bye now.